Deficiency virus was discovered. In the jungles of Cameroon, African primates had been victims of a virus present in their population for thousands of years. It was the simian immunodeficiency virus or simian immunodeficiency virus. However, while a large number of species and a significant percentage of their specimens were found, there were some animals that seemed to be healthy. The evolutionary adaptation of the hosts played a fundamental role. An example is the case of the monkeys known as manga besujin, who could carry the virus without developing the disease. Somehow, over time, the barrier between species was crossed. At the beginning of the 20th century, the virus was transmitted from chimpanzees to humans, and the mutation turned out to be much more dangerous than the simian version. The contagion occurred several times until in the middle of that same century, an infection occurred in Central Africa, where the maximum diversity was manifested. Initially, it went unnoticed without causing much commotion, until it started affecting the populations of the wealthiest nations. In these places, the deterioration of the immune system caused by the disease was strikingly noticeable, mainly because it could not be easily confused with the weakening that was common in less developed places due to many other factors. And this was especially evident in well-equipped and funded medical and disease control systems, thanks to which the situation could no longer be ignored. Especially when the number of cases began to grow alarmingly, unleashing an epidemic that would grow and wreak havoc throughout society. In 1959, the blood of a man who had seemingly contracted a virus in Kinshasa, Congo, was stored as part of a medical study. The theory being considered was as follows. Possibly in a rural setting or in Cameroon, the man had been bitten by a chimpanzee or had cut himself while handling the meat of one. This would have exposed him to the infection. In that case, the individual would have passed it on to someone else, who then passed it to another, and so on. Over time, one of the infected arrived in Kinshasa, and from there the virus began to spread, mainly as a result of an intimate relationship. On June 5, 1921, the United States Centers for Disease Control and Prevention organized a press conference in which they detailed 5 cases of pneumonia caused by an opportunistic fungus, that is, those that take advantage of a person's weakened immune system to develop and cause a disease. The following month, multiple cases of Kaposi's sarcoma, a skin cancer type, were confirmed. This joint appearance of both diseases in several patients caught the attention of doctors, who conducted analyses and also discovered that the affected lacked the appropriate number of the same type of blood cells, and the coincidences became alarming when pink spots began to emerge on the patients. The detection of new cases was growing rapidly as the fear of the unknown infection did, which would soon have a globally known name. In 1982, the disease was officially named Acquired Immune Deficiency Syndrome or Acquired Immunodeficiency Syndrome. A new transmission route was also determined, from mother to child during pregnancy, childbirth, or breastfeeding. And the following year, some scientists would report the discovery of the virus that caused it. And that's how our story comes back to the beginning. In 1983, and the French virologist Françoise Barré-Sinoussi and her colleagues Jean-Claude Germain and Luc Montagnier were able to isolate the acquired immunodeficiency syndrome virus, purify it, and publish the discovery. 3 years later, it was finally named human immunodeficiency virus or human immunodeficiency virus. This discovery allowed the development of an antibody and the start of major research regarding possible treatments. That's how hope emerged in 1987. The United States Health Agency authorized the first treatment, but it was expensive and had a large number of adverse effects. Although there is the idea that human immunodeficiency virus and acquired immunodeficiency syndrome are synonymous, in reality the former is the virus that attacks the immune system, while the latter is the advanced stage of the infection. In 1994, when acquired immunodeficiency syndrome had already become the leading cause of death among Americans aged 25 to 44, the United Nations recognized the magnitude of the problem and established the joint UN program, known as UN Acquired Immunodeficiency Syndrome, which was dedicated to coordinating strategies, mobilizing resources, and providing leadership in the global response to the disease. And between 1995 and 1996, new classes of drugs emerged, marking the beginning of combinations of different types of drugs. The disease also began to be the subject of numerous controversies linked to religion, highlighted by the Catholic Church's decision not to support the use of condoms as a preventive measure. In this, awareness campaigns played a fundamental role, as they had been doing their part for years, and the information about contagion was clearer. It was mainly given through unprotected intimate relationships, significant exposure to infected body fluids or tissues, transfusions of contaminated blood, hypodermic needles, and from a mother to her baby. Unfortunately, in the process, many people were subjected to the harshest discrimination due to ignorance about an epidemic that generated panic worldwide, and among its victims there were even children. Due to his hemophilia, a genetic disease that prevents blood from clotting properly, a young man in the United States had been subjected to transfusions. Neither the boy nor his family imagined the terrible outcome. The blood was contaminated. That's how Ryan White, 13 years old, became one of the first child victims of acquired immunodeficiency syndrome in that country, and the outlook was bleak. He had been given just 6 months to live. But Ryan was determined to carry on and wanted to do what the rest of the kids his age were doing at that stage, focus on his studies. Eager to resume them, he chose for them the school in Kokomo, Indiana, which he had attended the previous year. The institution's response would definitely shatter his illusions. Doctors had assured that acquired immunodeficiency syndrome was not dangerous to other students with whom he might have contact, but society's ignorance about the disease and widespread panic caused both parents and teachers to fervently protest against the boy returning to school, fearing that he posed a risk to everyone. 117 parents and 50 teachers signed a petition to prevent his admission, which was ultimately granted by the principal and the school board. This began a long struggle by the White family to overturn the ban, which they initially tried to fight with lawsuits. The case was initially ignored due to the lack of information about the disease, but the medical journal New England Journal of Medicine would manage to reverse that stance. Through a published study, it assured that the risk of infection from close contact with acquired immunodeficiency syndrome patients was minimal or non-existent. To do this, they had investigated for 3 months 101 people who had interacted without having relations with seropositive people, that is, who had contracted the human immunodeficiency virus, and nothing indicated that this interaction represented a danger. That same month, Ryan was examined by a doctor from the education department and was allowed to return to school, but that was not enough to convince everyone. 151 out of 360 students missed classes, and as a result of parents' complaints, the same day a judge signed an order. Once again, the boy faced discrimination and was barred from attending the institution. As if this wasn't enough, his girlfriend's parents also forbade her from seeing him. At school, the children insulted his younger sister and he couldn't even find peace in his neighborhood. The rumors that the boy was scratching and biting people, as well as spitting in the food at the markets, were getting stronger and causing more and more rejection. Despite facing numerous threats and challenges, Ryan managed to start the new school year and dedicated himself to his studies at that school until one day a bullet went through the family room window. The incident led the family to make the decision to move to Cicero, Indiana, where he was able to enroll in a much less stigmatizing school, Hamilton Heights High School. There he was received without any kind of resistance. The story captivated media and global attention, leading Ryan to engage in TV programs, educational campaigns, and charitable acts, making him a true reference for people with acquired immunodeficiency syndrome in the United States. He even forged a great friendship with singer Elton John, who helped his family buy a house. And although he was far surpassing the initial prognosis of the doctors, the cruel disease would soon claim its due. Ryan's last public appearance was alongside then United States President Ronald Reagan and his wife Nancy as host of an Oscar Awards party in California. 3 days later, he had to be hospitalized and finally passed away, living 5 years longer than had been predicted. After his death, numerous charitable activities and donations were carried out, foundations were created in his name, and even the Ryan White Care Act was enacted, focused on providing federal funds to improve care and health services for people affected by acquired immunodeficiency syndrome in the United States. Sick people were fiercely marginalized by both the community and their friends, and in some cases, even by their own families. And all of that as a result of misinformation and the amount of myths that surrounded acquired immunodeficiency syndrome. Ryan significantly contributed to changing the general perception of acquired immunodeficiency syndrome in a large part of American society. Previously, for example, there was the mistaken belief that this disease only affected the gay community, as the first cases were primarily identified among gay men in New York and San Francisco. This is how the homosexual community was initially attributed the responsibility for the emergence and spread of human immunodeficiency virus in the West. Some religious groups even claimed the virus was divine punishment aimed at gays for their sins. Beliefs that to this day persist in some communities within Christian and Muslim ideologies and beliefs. There were not a few who argued that the disease was due to the depraved lifestyle of homosexual people, even when the spread in Africa was mainly through heterosexual relationships. This erroneous association based on prejudice led society to completely blame them for the contagion. But Ryan White's diagnosis changed this perception by showing that acquired immunodeficiency syndrome did not discriminate by sexual orientation, although the conclusion in some cases continued to stigmatize. The boy was considered by many to be an innocent victim of the epidemic. Fortunately, Ryan himself and his family rejected the label, aware that it implied that homosexual people were to blame for their infection. Wanting to avoid any kind of pointing towards the gay community, and without making differences regarding the ways of contagion, the mother of the already deceased young man expressed to the New York Times that her son had always claimed to be like any other person with acquired immunodeficiency syndrome, regardless of how he had contracted it. She stated that the boy claimed he could not have lived as long if it were not for the gay community, which did everything possible for him to know about the available treatments, and commented that he met many mothers who did not want to work collaborating with people from the collective, pointing out the need for them to make a change in mentality and attitude. It was also incorrectly believed that the virus could spread through casual contact like hugs, cheek kisses, handshakes, touching contaminated surfaces, and by a sick person sharing utensils or being in the same environment without protection. People free of human immunodeficiency virus were reluctant or outright refused to share cutlery or drinks, clothes, and even use the same bathroom, bed, or pool as an affected person. And this mistrust intensified when it was also believed that the virus could be transmitted through the air. The belief that it could spread through saliva, sweat, and tears was also very popular at the time, which caused greater and more severe segregation of sick people. Although not all myths pointed towards humans, there was also for a time the false belief that mosquitoes, ticks, and other insects transmitted human immunodeficiency virus through their bites. Over the years, more accurate information and numerous awareness campaigns around the world managed to educate the population not only to prevent the disease or at least detect it in time, but also to promote healthy behaviors in relation to human immunodeficiency virus and, of course, eliminate stigma and discrimination. Today, fortunately, the reality of infected people is quite different. Thanks to antiretroviral treatments, people living with human immunodeficiency virus can lead a life that resembles those who suffer from chronic diseases without experiencing the opportunistic infections associated with untreated acquired immunodeficiency syndrome. These treatments are lifelong and usually consist of a combination of several drugs that must be taken daily and help to reduce the concentration of human immunodeficiency virus in the body, known as viral load, which also significantly reduces the risk of transmission. If the viral load is reduced to an undetectable concentration, that is, if the human immunodeficiency virus in the blood is too low, infected people can even have unprotected sex without any risk of transmitting the virus to their partners, something unthinkable not so long ago. Antiretrovirals also prevent human immunodeficiency virus from reproducing and also reduce the likelihood of developing resistance. In this way, the immune system remains strong enough to fight infections and certain types of diseases related to this virus. Even the United Nations body assured that a person with human immunodeficiency virus who starts treatment has the same life expectancy as another of the same age who is not affected. While there is still no cure or vaccine, treatment brings infected people closer to a normal quality of life. Without it, the average lifespan for a person after infection is 11 years. And although these drugs are more accessible in developed countries, their availability is increasing in developing nations, especially in Latin America. Unfortunately, in regions like Africa, Asia, and Eastern Europe, many still lack access to treatment, leading to the development of opportunistic infections and the death of those affected. In Western countries, the rate of human immunodeficiency virus infection has slightly decreased. This is partly due to the implementation of safe, intimate practices among gay men, and also to a lesser extent to free syringe distribution programs and educational campaigns for injectable substance users about the dangers of sharing needles. The spread of infection among heterosexuals was ultimately slower than initially feared, possibly because the virus turned out to be less transmissible through this type of encounters than believed, and also due to increased use of condoms due to pregnancy risks. Unfortunately, some groups in developed countries experienced an increase in infection rates. This is partly attributed to the younger generations who did not live or do not remember the most critical phase of the epidemic in the 80s, so the fear of the disease has significantly reduced. Moreover, the consistent use of condoms, a key practice to prevent virus transmission, also declined. Despite the fact that mortality rates have decreased in Western countries due to effective therapies, acquired immunodeficiency syndrome remains a problem among intimate service workers and injectable users. In underdeveloped countries, especially in Central and Southern Africa, poor economic conditions lead to the reuse of syringes in health centers. This, coupled with a lack of sexual education, often motivated by religious reasons, results in a high infection rate. In some countries, more than a quarter of the adult population is human immunodeficiency virus positive. Fortunately, in nations like Uganda, Zambia, and Senegal, prevention programs have been implemented with varying degrees of success to reduce human immunodeficiency virus infection rates. Great figures like Rod Hudson, Freddie Mercury, Anthony Perkins, and Michel Foucault died victims of acquired immunodeficiency syndrome, and others like Liz Taylor and Michael Jackson led fundraising campaigns to prevent and eventually cure the disease. Which today does not sound as utopian as it did a few decades ago. Currently, some patients have achieved total remission and are considered cured free of the human immunodeficiency virus. This is being investigated by scientists from various countries with the aim of understanding more deeply the interaction between the virus and the human body and developing better treatments. In some cases, patients receive trigger transplants with a surprising genetic mutation, one they inherited from their parents. Around 1% of the descendants of Northern Europeans, and that makes them immune to most of human immunodeficiency virus. This immunity stems from a mutation in the CCR5 protein, present in certain cells of the immune system. Human immunodeficiency virus uses this receptor to enter cells, but the mutation prevents this from happening. The transplants caused a change in the immune systems of the patients, giving them the mutation and of course resistance to human immunodeficiency virus. They stopped taking the virus medications to check if it reappeared, and the result was most encouraging. It did not. In other cases, the affected people simply controlled the infection through drugs, and upon stopping them, they remained with the undetectable virus in their blood for years without needing to resume medication. Even so, experts assure that these are specific populations that are under investigation, and that under no terms does it mean that patients have to abandon treatment, especially with the work that it took to get to this point. While the problem is not resolved, the situation of people with human immunodeficiency virus and acquired immunodeficiency syndrome has significantly improved compared to previous decades, thanks to various advances in research, access to treatments, and a fundamental part, awareness. Medications allow them to lead healthier and longer lives, while public awareness and educational campaigns contribute to changing perceptions and promoting understanding. Although there are still challenges to overcome, inequality in access to treatments, persistent stigma, and the need for more campaigns focused on prevention are some of the issues to address. The main challenge in the current fight against acquired immunodeficiency syndrome lies in providing diagnosis and treatment to all patients, in addition to combating the discrimination that impacts mental health. Of course, ongoing collaboration between governments, organizations, health professionals, the pharmaceutical industry, and us as a society should not be lacking. It is essential for this to happen that information does not stop reproducing and expanding at a faster rate than the virus, because as it has always been said, knowledge is power. And of course, antibodies, lots of antibodies.